911.
911, how can I help you?
Yeah, I've been having problems breathing all night. Just keeps on getting worse.
Okay, what caused this shortness of breath that you're experiencing?
I don't know. It's just been getting worse all night.
Okay, can I get your age, please?
I'm 70.
70? Okay, what is the address that you're currently located at?
I'm at 491 Westover, out in my porch.
Okay, I'll go ahead and send someone out to see you, and they should be there pretty shortly.
Okay, thank you.
Okay, Unit 137, you have a priority 2 for a 70-year-old male experiencing shortness of breath. He's located at 491 Westover. He's located on his porch. And
Copy that. Dispatch, we're responding. We'll be there in about 3 minutes.
okay.
Hi sir, how's it going? My name's Nathan. I'm EMT today. This is my partner Dom right here.
Nice to meet you. Nice to meet you guys.
Okay. Seat safety. We got our gloves. What seems to be the issue here? You're having trouble breathing.
It's been getting worse and worse all night. You know, it started with just a little bit, but now
Okay.
really having issues.
Are you the only one here?
Yeah, I'm the only one home.
Okay, so it's just you. Okay. Well, I see that. Yeah, I see that you're having a little bit of trouble breathing. You're using your accessory muscles, so we're gonna go ahead and call ALS for you in case it gets any worse. We can meet them en route. Did you fall or anything, or?
No, I've just been sitting here for a couple hours.
Yeah, so no C-spine, Dom. Okay, so what's your name, sir?
It's Alec.
Alec. Okay, Alec. And do you know what time? Yeah. Do you know what time of day it is?
It's like 5 o'clock in the afternoon.
Okay, and is this your house here? Where you at?
Yeah, this is my house. I live here.
All right, and this is gonna be a little odd question, but how many quarters in a dollar?
Four quarters.
Four quarters in a dollar. Okay. Okay. So my partner here, he's gonna be listening to your lung sounds. He's taking your heart rate, so we can see if we need you to take you to hospital quickly or anything. You got everything you need to get here, Dom? Are you still?
Just about.
How do his lung sounds? Dry?
Dry.
Dry. Okay. Well, everything seems okay. How's his heart rate, or a little elevated?
His heart rate is 116. His skin is pink, ashen, and warm.
Okay.
His breathing, he has about 26 breaths a minute.
Gotcha. Okay. So we're gonna go ahead and transport you to the hospital. St. Agnes fine?
Yeah, that's fine.
Okay. We're gonna go priority 2.
Okay.
So let's get him loaded into the ambulance and let's go. Okay. Actually, sir, before we go, I'm a little concerned with your breathing, so we're gonna go ahead and my partner's gonna hook you up with some oxygen here. He's gonna put you on a nasal cannula, so it's gonna go in your nose. We're just gonna do a pretty low rate because your breathing's not too bad right now. So we're gonna do about 2 liters a minute probably. So he's gonna hook that on, and then you should feel a slight burst of air when he turns on the pressure here. Nothing too bad. Okay. All right. So now we're gonna get you loaded and we're gonna get you going. All right. Okay, sir. So we're taking you to St. Agnes here. I'm gonna get some history on you. That's all right. So, signs and symptoms would be our first things. Can you tell me, like, did you have anything else other than difficulty breathing, or was it just that?
It was just a gradual change, getting worse.
So over time, it wasn't super sudden.
No, not sudden at all.
Okay. Are you allergic to anything?
No, I don't have any allergies.
Okay. Do you take any medications?
I have at-home oxygen.
You take oxygen at home. Okay. Any past medical history that I should know about? Recent surgeries or anything?
I have CHF, emphysema, and hypertension.
Gotcha. Last oral intake? Did you eat dinner yet, or was lunch?
It would just be lunch.
Lunch.
A few hours ago. It was about 5.
And events leading up to the incident, what were you doing? Can you give me a quick rundown?
I was sitting there on the porch and smoking a cigarette.
Okay. How long have you been smoking for?
About 50 years.
About 50 years, okay. Yeah. All right. Well, is it okay if I get some vitals off of you, sir?
Oh, yeah.
Okay. So I'm gonna get your respiratory rate and your heart rate, and I'm also gonna take a blood pressure. And lastly, I'm gonna get an SpO2 level on you, so go ahead and put this on your finger. And then I'm gonna put this on your arm. Let me feel your Okay, your blood pressure looks alright. Your SpO2 is a little bit better now that we got you on that oxygen. Your respiratory rate is a little bit elevated, so hopefully that oxygen helps slow you down a bit. You were at 26 breaths a minute, but luckily with this oxygen we got you on, you're now closer to 22, so that came down a bit. Your blood pressure stayed about the same. Your heart rate came down, it was 116 and now it's 100, and your SpO2 jumped up to 92. So you're looking okay. You should almost be there to St. Agnes, but I'm gonna just keep reassessing you back here about every 5 minutes. But I'm gonna ask you some questions. Do you have any pain going on anywhere?
No.
Does okay, so you just got that chest discomfort that
Yeah, it's just the breathing.
Does anything make it better or worse, or just it's pretty constant?
It's pretty constant. I feel a
Okay.
little bit better now, but
Okay.
it's still pretty constant.
Alright, well, I am going to check that. We got your history, we got your pain, so yeah, I'm just gonna keep reassessing you about every 5 minutes until we get there, and then my partner will pull up and we'll get you in to see someone right away.
Okay.
Okay. Hi, okay, so I got a patient here. It's Alec. He's 70 years old. He was complaining of difficulty breathing with gradual onset. He has history of emphysema brought on by CHF. His respiratory rate was 22 breaths a minute. He had 100 beats per minute for his heart rate. His blood pressure was 136/86. His SpO2 on 2 liters nasal cannula was 92%. And that is it.
Okay, thank you.
Yeah, no problem.